Hello everyone, I'm Mary Joy Natanauan. Now I'm gonna discuss to you the 10 attitude and qualities as a good caregiver. Number 1, patient. As a good caregiver, dapat mahaba ang ating pasensya sa ating mga pasyente. And number 2, cherry diminor. Dapat lagi tayong in a good mood, lagi tayong nakasmile sa ating mga pasyente. Example, kagaya na rin po nito. Ganito po. For example, like this, lagi po tayo nakangiti. And number 3, multitasking. Kahit anong ipapagawa sa atin, kaya natin itong gawin. And 4, being able to think quickly. Madaling makaintindi sa sinasabi ng doktor. Pag sinasabi ng ibang tao na madali mo itong maipasok sa utak mo. Kagaya ng sinasabi nga po ng doktor about medication. And number 5, punctuality. Punctuality, dapat lagi po tayong maaga na pumasok sa ating mga trabaho. And number 6, willingness to learn. Desidido tayong matuto sa mga bagay na gusto nating gawin. Being a good listener. Dapat marunong tayong makinig sa mga taong nagsasalita. And number 8, kindness and empathy. Sa kindness and empathy, naandun yung love, care, and companion, malasakit sa ating mga pasyente. Number 9, willingness to go extra mile. Kahit ito ay malayo, desidido tayong pumunta at magtrabaho. And number 10, being able to take responsibility. Dapat responsable tayo sa lahat ng ginagawa natin o kung ano man yung trabahong ipapagawa nila sa atin. And that's all. Thank you.
Good day to each and everyone. Today, I'm gonna present to you how to transfer patient from bed to wheelchair, from wheelchair to bed. First, proper hygiene. We need to wash hands first before we start. Then, provide privacy. Para po magawa natin na maayos ang procedure na gagawin natin sa ating mga pasyente. Then, introduce yourself to your patient and explain the procedure. Now, I'm gonna start. I need to wash my hands. Ito po yung patient ko. I-bend ko po yung knee niya. Yung arm. Tapos, ipatagilid na po natin siya. Tapos, ibaba po natin yung legs niya. Tapos, yung hand po, hawak dito. And then, the other hand, sa may neck, papunta po sa likod. Then, paupuin na po natin siya. Ganyan po. Ipitin po natin konti yung legs niya. Make sure po na ang wheelchair malapit siya sa bed para hindi po tayo mahirapang maglipat ng ating patient sa wheelchair. Itataas po natin yung arm niya. Hawak po tayo dito sa may pants niya. 1, 2, 3. Ganyan po. Nailipat ko na po siya sa wheelchair. Ngayon naman po, ang gagawin ko, ililipat ko naman po siya sa bed. Itataas lang po yung kamay niya. Hawak po dito. 1, 2. Tapos, i-bend lang po natin konti. Tapos, hawak po ulit tayo dito. Pahigain po natin ang pasyente natin. Tapos, itaas po natin yung legs niya. And ganyan lang po. And that's all. Thank you. Hi, I'm Mary Joy Natanauan, student of Nurse Caregiver Management Alliance. Today, I'm gonna perform infant bedding procedure. Provide privacy. Close all the curtain and door. Turn off the aircon and fan. Gathered all the materials needed. We have basin with warm water, cotton buds and cotton balls, comb, thermometer, soap, shampoo, towel, diaper, and cloth. Then hand hygiene. Wash hands. Then inform the mother and explain the procedure for baby's bedding. Good morning, ma'am. How are you? I'm Mary Joy Natanauan. I'm caregiver for today. Now, I'm gonna take shower for your baby. The best time for baby shower is between 6 to 10 in the morning. Before we proceed for baby's bathing, we need to check first the baby's body temperature. It must be 36.5 to 37.5 degrees Celsius. And then check the water temperature using elbow, 37 to 38 degrees Celsius. And remove clothes. I'm gonna wash the eyes first. I will use cotton balls. I'll dip in the water and squeeze. I will start from the inner canthus going to the outer canthus. Inner canthus going to the outer canthus. Then I'm gonna wash the face. I will start from the forehead, going to the nose, going to the chin. And then I will also do it to the other side. Going to the nose, going to the chin. And also clean the outer part of the ears. Then pat and dry. Then hold the baby in football position. Then wash the hair with warm water. Then put shampoo. Clip properly from up, going down, and then side. Rub it properly to remove the dirt. And then after that, wash. And pat and dry. Then I'm gonna clean the neck. I clean the neck going to the back of the neck. We'll make sure po, need to clean it properly because of the excess milk stay here in the neck. And then clean the hand between, clean the finger also because the dirt here inside the finger. Clean, going down, going to axilla. And then I will do it also to the other side. Between the finger, going down, going to the axilla. Then I'm gonna clean the chest with soap. Clean the chest, going to abdomen and also the side, sa baywang po. And after that, I remove the diaper. For cleaning the vagina, I need 7 cotton balls. 3 I use to the other side, and 3 the other side, and 1 in the middle. I'll dip in the water. I'll start from up, going down to the anus. Up, going down to the anus. I'm going down to the anus. And also, I will do it to the other side. And then one in the middle. Then I'm gonna clean the legs of the baby. We need to clean po the hips of the baby, going down to the foot. Clean between the fingers. Because the dirt is stuck inside the fingers, we need to rub it properly. And then also I will do it from the other side. And after that, turn side the baby so I can clean the back of the baby. Clean with soap. I clean it properly from back, going to the back, going down to the foot. Then, I'm gonna put the baby in the basin with warm water. Wash properly the baby to remove all the dirt and also all the bubbles from the body. And after, pat and dry. Put diaper. And cloth. Then, balutin na po natin ang baby. Then, give to the mother. Then, clean all the materials has been used. And then, document the baby's chart for baby's bathing procedure. And that's all. Thank you. Good day to each and everyone. Today, I will show you how to clean and sterilize the feeding bottle and the proper burping of baby. We have materials needed. We have basin with water, feeding bottle, clip, brush, sponge, towel, liquid soap for bottle, distilled water, hot water, and milk. First, proper hygiene. We need to wash our hand before we start. This is the feeding bottle. This is already used. I will wash it into the running water. And then, ilalagay ko lang po siya sa basin na may water. Then, lalagyan ko po siya ng liquid soap for bottle. Then, ibabrush ko na po siya. I-clean po natin yung bawat surface ng bottle. Baka po may mga tira-tira pang gatas. Yung labas po, pwede natin siyang gamitan ng sponge. And also the cover. Linisan po natin maigi. i-brush din po natin ito. Tingnan po natin ang bawat gilid niya. Baka po, yun nga po, may natitira pa. And then, ito pong nipple, gamitan po natin siya ng small brush. After ko pong linisan, babanlawan ko na po siya. Then, ilalagay ko na po siya sa boiling water. Ibo-boil lang po natin siya 15 to 20 minutes. Lalagyan ko lang po ng cover. And then, ito naman pong nipple, saglit lang po natin siya ilalagay. 5 minutes lang po kasi madali lang po itong matunaw.
A few moments later.
Then, okay na po siya. Kukunin ko na po yung bottle sa boiling water. Lalagay ko lang po siya dito. Then, after ko pong ma-dry yung bottle, gagawa na po ako ng formula para sa baby. Ang paggawa po ng formula, depende po sa age ng baby. Kaya importante po na basahin po natin kung ano pong nakalagay dito bago po tayo gumawa. Lalagyan ko lang po ng 3 scoop. And then, lalagyan ko po ng hot water. And also the distilled water. Then, i-shake ko po siya. I-shake po natin kung maigi para lahat po ng gatas sa loob matunaw. And after that, i-check ko lang po yung temperature ng tinimpla natin formula bago natin ibigay sa baby. Dapat maaligam-gam lang po siya, wag po yung mainit, baka po mapasok si baby. Then, kukunin ko na po ang baby. Ang paghawak po ng baby, dapat po nakataas po konti yung ulo niya bago natin siya bibigyan ng gatas. Lalagyan ko lang po ng towel, ng bibs sa liig niya para kung may malaglag na gatas, hindi po madudumihan ang baby. Mas maigi pong umupo na lang po tayo para hindi tayo mahirapang mag-feed sa baby. Huwag po natin pilitin ang baby kung hindi niya kayang ubusin yung formula na ginawa natin. Kasi baka magsuka lang po siya. Then after that, ipapa-burp ko naman po siya. Maglalagay lang po tayo ng towel dito just in case na pag mag-burp siya, hindi po maiwasan may lalabas po sa bibig niya para hindi po madumihan yung gamit natin. I-burp ko na po siya. Ganyan lang po ang pag-burp. Wait lang po tayo na mag-burp yung baby. After po mag-burp, ibabalik ko na po siya sa bed. Lagi po natin i-check yung baby after niyang mag-feed. Para po safe po tayo na wala po talagang mga gatas na lalabas pa sa bibig niya. And then, we gonna clean all the materials has been used. And that's all. Thank you. Good day to each and everyone. Today, I'm gonna perform complete bed bathing. First, I'm gonna wash my hands. Provide privacy. Close the curtain and turn off the aircon and fan para maiwasan po natin na lamigin ng ating pasyente habang pinapaliguan natin sila. Then, I'm gonna introduce myself to my patient and explain the procedure. We need materials needed. We need shampoo, towel, comb, facial swab, face towel, water basin. Make sure the water po is warm water lang po ang ipapaligo natin sa patient natin. And then cloth, pail, cup, plastic table cloth. And now I'm gonna wash the face. Magsusuot lang po ako ng gloves, pero optional lang naman po itong gloves. Kukunin ko lang po itong facial swab, i-dip ko lang po siya sa water, and squeeze. Ipunas ko po sa eyes niya. Don't use soap po sa mata niya. And then, yung towel po, basahin ko lang po siya. Then, ang pagpunas po, from forehead, going to the nose, going to the chin. Ganun din po sa other side. Then, itagilid lang po natin siya. Linisan po natin yung ears niya. And sa other side po, ganun din. And also the neck. Then, ida-dry ko na po siya. Then, cleaning the chest and abdomen. Tanggalin ko lang po yung cloth niya. Linisan po lang po yung chest niya and also the abdomen. And maglalagay po tayo ng towel dito para po hindi mabasa ang bed natin pagka nililinisan natin ang ating patient. Ang pagpunas po, start po tayo dito. And then, iside lang po natin siya para po malinisan natin yung likod niya. Then, i-dry na po natin. Isuot ko na rin po yung cloth niya sa other side. And ganun din po ang gagawin ko sa other side niya. Iside ko rin po siya. Para po malinisan din po yung likod niya sa kabilang side. Then, i-dry ko po. Isuot ko na rin po yung other side ng cloth niya. Then, cleaning the lower part. Tanggalin ko lang po yung pants niya. And then, i-wipe po siya ng wet towel. Ganun din po sa other side. After that, i-dry ko na po yung legs niya. Then, isuot ko na po yung pants niya. And now, isa-shower ko na po yung hair niya. First po, ito po yung gagamitin natin na warm water pag isa-shower natin ang ating patient. Basahin po muna natin. Then, put shampoo. Make sure po na may nakasahod po dito sa baba para hindi po mabasa yung sahig niya, sahig natin pag pinapaliguan natin ang ating patient. After ko po ma-shampoo, badlawan na po natin. Then, ida-dry ko po. After ko pong ma-dry, i-comb na po natin ang ating patient. Hi, I'm Mary Joy Natanauan, student of Nurse Caregiver Management Alliance. Today, I'm gonna perform occupied bed making. Gathered all the materials needed. We have blanket, bottom sheets, top sheets, throw sheets, and pillowcase. Then, I'm gonna introduce, verify, and explain the procedure to my patient. Good morning, ma'am. I'm Mary Joy. I am here to do your bed. I need to change it to the new Renance. Is that fine with you? Okay, can I have your name, please? Okay, may I know your birthday?
July 10.
Okay. Then next, then provide privacy. Close the curtain. And hand hygiene, wash hands. Then I already washed my hand. I'm gonna put my glove. Then remove the top bedding and any things attached in the bed. Loosen the top linen. Then, I'm gonna put the bath blanket. This blanket is for the patient privacy. Then I will ask my patient to hold the blanket. But if our patient is unconscious, just put the blanket under her shoulder. After that, remove the old blanket. And now I'm gonna change the bottom sheets and draw sheets. I'm gonna turn only my patient to the other side, but before we turn the patient to the other side, make sure po na may nakaharang na rail sa higaan niya para hindi po siya malaglag. Isa-side ko na po siya. I-fold ko lang po yung head niya. And also yung feet po, i-fold ko lang po yung feet niya kapag ano. I will count 1, 2, 3, ma'am. Can you cooperate with me? Okay. 1, 2, 3. Okay. Then, remove the bottom sheet and draw sheet by rolling this, going to the patient and the middle. Then, apply the new bottom sheets. Then, ipo-fold ko lang po siya sa gilid ng pa-triangle. Then, i-insert ko na po siya sa loob. Then, ilalagay muna po natin ang draw sheets. Then, I will ask my patient again to roll to the other side. Okay, ma'am, can you roll it for a... Okay. 1, 2, 3. Then, remove the bottom sheets and draw sheets. Then, pull the bottom sheets and also the draw sheets. Then put the blanket Can you hold this, ma'am? Then remove the old blanket. Then, ipo-fold ko lang po siya dito. Then, hayaan na po natin siya nakaganyan. Then, change the pillow. I'll change the pillowcase. Then, remove the gloves. Wash hands. And document the patient chart for changing bed sheets. And that's all. Thank you.
Hi, I'm Mary Joy Natanauan, one of the students of Nurse Caregiver Management Alliance. Today, I'm gonna demonstrate the NGT and PEG procedure. But I will do first the NGT procedure. NGT, it is also called rice tube. Tube pass through the nose, down the esophagus, and into the stomach to the small intestine. But before we start, I'm gonna check the doctor's types of amount and frequency of tube feeding. This is to be sure that we are doing the right procedure to the right patient. Then gathered all the materials needed. I have water, milk, syringe, gloves, tube feeding, stethoscope, the plaster, and towel. Then provide privacy. Close all the curtain and door. Then introduce, verify, and explain the procedure to the patient. Good morning, ma'am. How are you? I'm Mary Joy Natanauan. I'm your caregiver for today. Can I have your name, please? May I know your birthday, please? Now, we will doing the tube, NGT tube feeding. Is that fine with you? Okay. This is to help you to get enough nutrition to grow, develop, and recover. Then adjust the bed 45-degree angle. Then I'm gonna wash my hands. After I wash my hands, I'm gonna put the gloves. Then I'm gonna put the towel in the chest of my patient. This is to collect any spilled or dropped food from the tube. Next, I'm gonna remove the cover of nasogastric tube while folding it. Then I'm gonna attach the syringe into nasogastric tube. Then check and aspirate the residual of tube feeding into the patient's stomach. And now I'm gonna aspirate.
Then elevate as if to syringe 18 inches above insertion site while feeding. And now I'm gonna pour the formula 30 to 60 ml at that time. And then flush 30 ml of water. Water is to prevent sticky blockage from sticky formula. Then fold the nasogastric tube. Then detach the syringe and cover it. Check the patient response after feeding. Then remain the position of our patient for at least 30 minutes to prevent risk of aspiration. Then remove the towel. Then clean all the materials has been used. Remove the gloves. And wash hands. And now I'm gonna document the patient feeding amount and the response of our patient. And now I'm gonna demonstrate the PEG procedure. PEG or percutaneous endoscopic gastrostomy is a tube passed into the patient's stomach through the abdominal wall. Then provide privacy and check the patient identity and feeding order. Then I'm gonna introduce myself now to my patient. Good morning, ma'am. How are you? I'm Mary Joy Natanauan. I'm your caregiver for today. Can I have your name, please? Okay. May I know your birthday, please? Okay. Now we will doing the PEG feeding. Is that fine with you? Okay. Adjust the bed 30 to 45 degree angle for comfortable working position. Then perform hand hygiene. I'm gonna wash my hands. Then uncover the patient's stomach. And check the patient and ask her when she was last bowel. Position the patient into polar position. And now I'm gonna wear my gloves. Then I'm gonna put the towel on the top of the abdomen of our patient. This is to collect any spilled or dark food from the tube. Then open the tube and attach the syringe. Then check or aspirate the residual into the patient's stomach. And now I'm gonna aspirate. I need to fold this first before I remove the syringe. Then, pour 30 ml of water. Then, fold the tubing to avoid administer of air in the stomach. Then, pour formula or any medication. Then, flush 60 ml of water. Then fold the tubing and remove the syringe and cover it. Then check the patient after feeding. Then clear all the equipment has been used. Then remove the towel in the patient abdomen. And let our patient in follower position for at least 30 minutes to prevent risk of aspiration. And I'm gonna remove my gloves. I'm gonna wash my hands and document the patient chart, the amount of first flush of water, final flush of water, the residual, and the feeding formula intake. And that's all. Thank you. Today, I'm gonna demonstrate the vital signs. Gathered all the materials needed. I have a stethoscope, pulse oximeter, thermometer, sphygmomanometer, and watch. And now, I'm gonna introduce myself to my patient, verify, and explain the procedure. Good morning, ma'am. I'm Mary Joy Natanauan. I'm your caregiver for today. Can I have your name, please?
Yuli.
Okay. May I know your birthday, please?
July 30th.
Okay, thank you. Now, I'm gonna check your vital signs. Your body temperature, oxygen level, pulse rate, respiratory rate, and blood pressure. Is that fine with you? Okay, thank you. Do you have any illness or pain? Okay, thank you. Then, provide privacy. Close the window, and assuming I already washed my hands, then first I'm gonna check the oxygen saturation or the oxygen level using the pulse oximeter. Now I will put the finger here. I'm gonna open first, then I'm gonna put the finger. Okay, now my patient oxygen level is normal, 98%. And now I'm gonna check the body temperature. The normal body temperature is for adult is 37 degrees Celsius. The patient is normal, 36.7 degree. And now I'm gonna taking the pulse rate palpate, the count of pulse rate per minute. The normal pulse rate per minute is 60 to 100 beats per minute. And now I'm gonna put my finger here, and then I check. Okay, it's normal. Now I'm gonna check the respiratory rate of my patient. I'm gonna use the stethoscope. The normal breaths for adult is 12 to 20 breaths per minute. Okay, my patient, she's normal beats per minute. And now I'm gonna check the blood pressure. The blood pressure for adult is 120/80. Can I help her? I will check her first before I put the sphygmomanometer. Okay. Then, stethoscope I will put here. The blood pressure of my patient is normal, 120/80. And now I'm gonna document my patient chart. The body temperature, the oxygen level, pulse rate, respiratory rate, and blood pressure. And that's all. Thank you.